Welcome back to Therapist Voices at ReachLink. ReachLink is a digital mental health counseling platform. My name is Jessica Hurwitz, and I oversee ReachLink's network of therapists. My guest today is Suzette Fagan, LCSW. She's the CEO and founder of Door-to-Door Therapy. Dr. Fagan has over 20 years of trauma-informed care experience. Now, Dr. Fagan, you started in New Jersey, and you're now expanding across multiple states. Is that right? What states are you
Yes.
in?
Currently, I am in, of course, the state of New Jersey. I am in New York, Pennsylvania, Connecticut, Delaware, North Carolina, South Carolina, Utah, Virginia. I am in 12 states.
Wow. Oh, okay.
Yes.
For some reason, I thought it was just a couple. That's amazing. Those are some really, from my side of things and, provider network stuff, those are the high need states. That's amazing.
That's one of the reasons why I thought that it would be necessary to actually expand, because at the end of the day, at door-to-door therapy, one of the things that we want to ensure is that there are no barriers towards accessibility. We want our patients to be able to know that if you are willing, if you are ready, we are here.
Suzette, you stole my line because I was just about to say that I was about to say that something that was so clear to me from your website and everything that we communicated about is how significant your stressor is on removing barriers to care. And I know we talk about that so much that everyone
Yes.
seems to want to remove barriers to care. And I know so many people are successfully doing that. But I feel like there is something special with you and you were really able to do that differently. Can you tell us a little bit about you, about how this practice came? I feel like there's more to it. There's more to Suzette.
So, just to kind of give you a little background information about myself, I am Caribbean from the best island in the Caribbean. I am biased, which is Jamaica. So here I am, a Jamaican, Caribbean person, growing up, and I came over to the United States when I was 10 years old. Like so many Caribbean people, especially Caribbean girls, experiencing so many different levels of trauma and not being able to speak about it, that became one of the central part of my childhood that I remember. Who can I tell what happened to me? Who can I share my story with? And so, therefore, that became an essential part. So here's my mom with crazy courage. This is Women's History Month, and I just highlighted her because I believe that
What's her
she
name?
is
What's your mom's name?
Normalin Rose, and there is nothing
Normal Rose.
normal about Normalin. And she had five of us. And imagine, so many years ago, I was 10 years old when I came over to the United States. And we all came in a one-bedroom apartment, five kids, four girls, one boy, my mom. And 2 years later, my brother got into a severe car accident. So, on top of already being in a marginalized environment, you now have a single mom struggling with the idea that her only boy, and especially in the Caribbean culture, boys are so I would say that they're so praised, they're so honored, they're so chosen, right? And now she has four girls, and her only boy now is dying. And I just remember the struggle that she had and being able to leave all of those things. She could not attend to her own mental health. She could not, deal with the fact that, okay, you now have four girls, you're already working three jobs. And
Three.
now she was working three jobs. My mom worked two jobs during the week and one job during the weekend. And so therefore it is five of us, and my brother was so intelligent and so smart. And in the hospital, we are looking at all of these scholarships that he would have gotten had he not gotten into this car accident, because he got into the accident when he was 17 years old. So 2 months before graduation. So those struggles and those things, watching my mom, tending to my brother, tending to us, learning a new culture, and just me being completely a complete brat. I would love to say that I was just such a wonderful daughter at that time, but I had my own struggles even previous to this. And so all of those things led me to the idea that mental health is absolutely important. It's something that we absolutely have to, in Caribbean cultures, you are told to be strong, and strength then be veiled in a sense of, if you show that level of vulnerability, it is weakness. And so it is at that, because of those missions, because of those experiences, I now understood, because I lived through it, what it is to experience helplessness and not having an opportunity to talk about that. And I went through high school, just dealing with a lot. I went through college dealing with a lot. And so when I became a single parent, that didn't go away. So these things have, when you don't deal with your healing, it is going to catch up to you one of these ways. You have to learn to heal and deal at the same time. And so that is why door-to-door therapy is important, because we want to open doors for people of all different cultures, wherever you are, that you can access health on your own time. Call us the Burger King of mental health. You can have it your way.
Oh, I love that. There was something on your site I noticed about concierge services that kind of makes me think that that's a little bit about what you're talking about.
So in COVID, one of the things that, you and I just went through a bonding moment of
Yes, we
dealing
did.
with technology. And so during COVID, here I am. I had a practice in Roselle, New Jersey, and I had to switch from doing in-person therapy, just like the whole world, and then dealing with telehealth. But here again, if you remember, doctors and nurses and the medical professionals, they did not have hours like we did. And so therefore, one of the things that I thought the least that I can do as a therapist is to be here whenever they were available. So I had medical professionals, emergency doctors, emergency nurses, anesthesiologists. They could not say, okay, you know what, Dr. Fagan, I am going to meet you at 6 o'clock because that's when I get off. They did not have normal hours. So therefore, we needed to be able to create, time and space for them. So I had a couple of them, and they basically said, when we need you, can we just contact you when we need you? And I said, absolutely. It is the least that I can do. So I was having sessions at 11 o'clock, at 10 o'clock, at 6 in the morning, at 7 in the morning, because that's when they were available. And for me, they taught me in a sense of, therapists should not necessarily always have mainstream hours, because life is happening all of the time. And so that's where the concierge concept came in, that you can have therapy your way.
I love this. I think when I saw this on your website, I thought I need to ask her about that right away, because I think that so many therapists do try to do something like this, and it's so hard to balance, which is what I'm curious what you would say about balancing that with your practice, having, other clients you see, and then being kind of really on call for this population. How are you able to manage and then also, of course, take care of the important girl there, you?
You know what? I am going to say that doctors make the worst patients, and one of the things that I am learning as I'm going, I do believe that being a therapist for me is not just a career, it is a calling. I do believe that I was placed on this planet for that. And as a result of that, no matter how tired I am before, as soon as I start, when you start flowing in your gift, it does make room for you. It's energizing. And so that is something that is important. Now, I should be able to tell anyone who's listening to just be, to be completely transparent. I have the luxury, my son is about to be 24 years old. So therefore I have, my two little doggies will say that they do need me to be a little bit more available.
Of course they
But
do.
I do have wags and they do get their walks a lot, okay? But the thing is, when we look at what is going on and we look at what is happening in the world, the explosion of anxiety and depression that occurred before, during, and after COVID, we are still living in the residual effect of all of those things. And I believe that one of the things that therapists must do, we have to make room for going outside of the norm. You want to be able to make a difference. You have to be able to look at the system and actually go outside of the system to make room for what already exists and what is growing. And for me, it was the idea that you cannot do therapy as usual because we're not living in usual times. So that in itself is something that I absolutely agree with. How do I balance? I also work with other therapists, and I am the main one, of course, in door-to-door therapy. I also supervise interns. So I work with local colleges in regards to providing internships and everything else like that. Because again, that is a passion of mine, making sure that the upcoming therapists have the skills necessary in regards to treating and listening and so forth, utilizing, the new stuff. But the old stuff is the thing that holds it together. So love the trend, love all of those things, but we can't forget the meat, on the bone. We have to just be able to deal with all of those stuff. So I believe that teaching is essential part of leading. You become ineffective as a leader when the skill just remain with you. So that is something that I believe is important. So I train the therapists that I have to utilize, telehealth in a different way. Because essentially that in itself is what we do. We utilize telehealth in a different way. We try to be able to make sure that it's just proximity and not presence. We want for you to be able to feel, even though there might be distance between us, but when we get on the screen, the presence that you and I have is reachable wherever you are.
It's huggable. It's
Yes.
huggable.
Yes, absolutely.
I'm not surprised to hear. I didn't know that you supervised, and I am not at all surprised. Just from what I know of you so far, I probably would have guessed that, like, certainly there's a teaching element here with her. So that makes total sense.
Yes. I do. I love my craft and I want it to be able not to be watered down, but for the people who are called to it, not for people who, use it as listen, everybody has to live. Everyone has to, but I don't like factor oriented therapy.
Yeah.
It has to be unique because people are dealing with some real things. People are hurting. And I speak as one who when my son was during his teen years, I had to utilize services. I had to utilize therapy, and that taught me a lot. So when I'm working with adolescents and everything else like that, I will just be able to say to them, like, listen, I know your parents want you to be here, but you get to fire me. If you are not feeling me, you have the freedom to fire me. And they said, I do. And when they have that sense of autonomy, when they have that sense of choice, they are able to kind of connect more in a real way. So that is the one thing that I learned as a therapist. As a parent, when your child isn't okay, you're not okay. And from a child's perspective, when your parent is not okay, everything is off. The system is off. And so it's really important that the family unit, in order, they start talking about policies and so forth like that. Let's check the family. Make sure the family is good, and then everything else will take care of itself. That's, in essence, what I believe. And even as a single parent, one of the things that I wrote about in the book Raising Davids with Xavion was the idea of, I understand that I am a single parent, but if I was on an island and I needed something, I would bring it in. So as a single parent, I needed to import certain things. I needed to import, good mentors in his life. I needed to build my own team, my own tribe. I am Caribbean. So at the end of the day, you start talking some stuff and I'm just like, okay, what we gonna do? So by the time I would hear what Davion is doing, my son is doing in school, I would have people talking to me. And so by the time I got to him, I was calm enough to just be able to say, okay, what happened? Because now I was calm. And when I had to watch him cross over and got his degree, I said to myself, this is a celebration of not just one person. This is a celebration of when systems work, when you are able to connect, even though, someone could say, I came from a broken system. My mom was a single parent. I became a single parent. But that didn't stop me from being able to, what I believe, produce a whole person, a person that maybe, having his own scars, because I am a crazy parent. I will admit that 100%.
Good. We don't want you any other way. That's how you have to be.
Yes. But at the end of the day, these are the reasons why we do what we do. Teaching is important. Mentorship is important. Building your tribe is important. Being, vulnerable in a safe way is important. So when I sit with a patient, a prospective patient, all of me come together. The parts of me that were broken, the parts of me that don't have it all together, the parts of me that's still trying to figure this stuff out, those come and we sit and we are in this room together trying to build something out of nothing. And oftentimes, I will say this, I don't need someone to tell me that I am a good therapist. I feel it. I know it. That is the validation that the universe gives me, and I am so very proud of.
Can I quote you, if I
Yes,
may?
absolutely.
Because even while you're dealing, you can still be healing. You wrote that to me,
Yes,
and I thought that was
yes,
so powerful and so
yes.
important. Maybe it sounds simple, but it's so not. When I read that, I sat and thought for a second, and I was like, "Oh, wait a second. She's right. That's true." Is that something that you bring into your practice?
Yes, because healing is not a it's not a destination, it's a journey. And while you are driving, just think about this stuff. While you are driving, you are going to encounter so many different things. You're going to encounter some, roadblocks. You may encounter some, traffic lights that's not always green, but you still got to keep on the journey anyway. And so I look at that in the sense of my healing doesn't stop because life happens to be lifing. I have to choose. And that is one of the things that I share with every one of my patients. Stuff is going to happen, and you're going to have to make a decision to deal. How do you deal? That's what therapy comes in. Show me how to deal better. Show me how to deal or handle it or acknowledge it so that I can get to the path of healing and restoration.
Suzette, something that you mentioned to me previously that I really want to hear from you about, because I've got a suspicion you've got something good on this. You've said how important faith is in mental health. Can you talk to us a little bit about that and what that is to you and how you bring that?
Can I get a little bit really personal?
Please. I beg of
S-
you. Please, this is the place.
So here I am, experiencing my best life. My son is stable. He's doing well in school. All was well with the world. And then the big bad wolf came in the form of a custody battle between my son's father and I. And I'm just like, what the hell? I have been here all the time. What do you mean? I was separated from my son for 7 months, 23 days, 11 hours, and 33 minutes. I remember that. That happened on April 15th. It will live with me for the rest of my life because I think that at that moment, I just really had a sense of just who I am and how life was supposed to be. And I thought that I had just went through stuff. I mean, come on. I decided that I was going to have this kid. I got pregnant in the church, and that's a whole story within itself. And I disappointed my mom by not being married. I finally got my shit together, and then
And now
and
this. Come
and
on.
now this.
Uh-huh.
I am just like, okay, God forgive me for using that word, but I'm real. So
I'm pretty sure it's appropriate in this exact situation. What other word could you use?
it was so crazy, to me because I'm just like I pride myself on being a good mom. I went to every PTA meeting. I went to every meeting. I was there. I was present. I was, if you look up helicopter mom, you would see a picture of me right then and there, just like, woo. But I
We're
say all
both
of
there
that to
next to each
say,
other. Don't worry. You're in good company.
but what happened is in the midst of my accomplishments, in the midst of my education, in the midst of everything else, my education, my money, that could not prevent what happened to me. Those 7 months, those 23 days, those 11 hours, I had every single emotion imaginable. I was watching. I went from watching Snap to watching all of the televangelists. I was just very dysregulated. So it was the idea that I had to come to myself. I literally became very depressed, very suicidal. I remember driving to work and calling someone and saying, I don't feel safe with myself. I need you to
Right.
stay on the phone with me because all of the voices in my head is telling me to just press the gas. And that was real. That was a real thing. I have two masters. I know this stuff. But everything, when you are in the middle of a crisis, everything goes out the window. And I had to be confronted with what I had left. And what I had was God, in the sense of, I hate you. I can't believe that you're allowing this to happen to me. And all I have, that's what I was living for. And I had to that's really where my healing started taking place, because I had to be confronted with the Suzette that never felt like she was enough. The Suzette who felt as if she had to perform to be okay, to feel that she mattered. And my son, if I didn't have my son, that was my identity. So when I didn't have that, I had to be confronted with myself, everything. And so it was from there. It was there that I said faith and mental health really go together. It was at that moment when people that I know in the church began to pray for me and with me. I began to really understand a bigger purpose, a higher purpose for myself. And then that's where Christ in the crisis was born, seeing Christ in the crisis, because that to me was what I knew how to do. Now, let me just pivot and let me just say this. I believe that religion is like chicken, right? It's like food. So I may eat I may eat curry chicken because I'm Jamaican. You may eat barbecue chicken, baked chicken, whatever. At the end of the day, it's still chicken. My faith says Christ. Someone else's faith could say, Jehovah. Someone else's faith could say Buddha. Someone else's faith could say something that moment. And so I believe that that's where a lot of therapists go wrong, in a sense where when you start talking about someone who's very staunch in the church or very staunch in religion, and how do we go through that? And I believe in some ways that you can utilize that because that's what's in the room. That's what's in the room. I want you to just be able to picture something that if a building is on fire and you're just like, we got to use whatever is in the room to get out of this building, you will use whatever. So when I meet with a patient and they said, this is who I am, this is my culture, this is what I believe, then you have to take what they believe and bring them there, because you are not going to get me outside the room if you are. How am I supposed to understand you when we're speaking a completely different language? Right? So we have to be able to utilize the language that's in the room, the resource that is in the room, and oftentimes it is a person's faith. And if you allow them to keep what essentially is there, they will be more open to mental health resources. That, you can say, what? Your faith wants you to be whole. Your faith wants you to have a relief of depressive symptoms. They want you to have a relief of anxiety. So what can we do that is comfortable to you? Do you need meditation? Do you want to be able to sit in a room and center yourself? That's connecting them to what they know. But as therapists, we understand that Rule 101, meeting your patient where they are. Was that
You
too
are the
much?
epitome of that. From what I have heard, you are the epitome of meeting someone where they're at.
Thank you so much. I appreciate that.
Truly. Even if it's a different kind of chicken that they're having.
Yes, absolutely. Even if it's a little spicy, because I like my food a little spicy.
Exactly. Can I ask you, Suzette, how did you, or did you have to, after all this happened and you were in this place, after everything happened with your son, were you in a place where you needed to reconcile with God in any way?
Oh, hell yes, in every way. I think that because my notion of God was absolutely ripped. I was already having a side eye view of God because, again, I was brought up into the church. As I told you, that my brother got into a car accident. So I, quote unquote, made a deal with God at 12 and say, I'm going to be a Christian if you let him live. And so, therefore, that in itself is that whole thing that I'm making a deal with you. I'm giving my life to you, and now you're gonna do this stuff? Come on now. This is a little bit wrong. And then I met this wonderful guy in the church. The first time I met him, he wanted to pray. I said, Jesus is Lord, because of course, that is amazing, right? You meet someone in the church and you automatically believe that that is going to be the person for you. And not no fault of his own. The one thing that he did do, and I am so grateful to him, I wanted to get married because that's what people do when they get into the pregnant in the church, is to cover it and to get married. And he was just like, no, best decision ever, ever. So I am grateful to him for that, because we would have been a complete mess. And we were a complete mess even not being married. But my relationship with God went through some major transformation. I had to rip up the script of what I believe my relationship should be. I had to throw it away because it was no longer working for me. I thought that God is supposed to give me what I want. I mean, this is what I want. Give it to me and just let me be. And one of the things that I want to mention here is that in the Bible, and I started studying this, it never Jesus never said, I want you to be healed. He always said, I want you to be whole. And there's a difference between healing and being whole. And so for me, there were aspects of my life that I no longer felt like the quote unquote girl who wasn't anything. I had two masters. I was buying another house. I felt accomplished, and that was great. But I am a human being, not a human doing. And so, therefore, I had to separate myself from my accomplishments, separate myself from what I do and who I actually am. And those 7 months was a journey within Suzette. I had to rip that all up. I had to just come to God, and I just had to say, I am so effing mad at you. Yes, those were my prayers. It was not holy. I did not talk to God as a quote unquote dearly loved God. No, I'm just like, you are full of what? Like, why would you do that to me? And it's in those moments, it's in the time of being okay. I felt that my version of who God is was okay with the broken me, was okay with the me that didn't feel like I am enough. And so that is the messiness, and it led me to my book, The God of the In-Between Girl, because I was in between so many different spaces, in a sense of like, I feel accomplished, but at the same time I feel like I'm not. I feel holy, but at the same time I'm not. I feel whatever. And it's in those moments that I had a new revelation of who God is and who God is to Suzette, you know. And that's why my faith is even stronger now than ever. I can walk into a room very comfortable with my faith. I don't care where, who, what. I am so, he and my relationship with God is at a point in which he's like, there goes my special little girl. She's special. She might be on the special side of heaven, but I am daddy's little girl. And I get to live that. And I get to know that he cares about little old me. No matter who I am, no matter what I do, no matter all of the dots, I could be the greatest thing today or nothing tomorrow, and he still look at me and love me. And so that to me is transformational. And that to me was the first part of my healing. And then to be able to now go and start speaking in churches and everything else like that led me to restoration, led me to the idea of God being able to restore what was broken, restore the functionality of who I am and all. So when I look at myself and I can look at a patient and just saying that what you are seeing as far as you are concerned is so minuscule in comparison to who you're supposed to be. And it doesn't matter how you're feeling. You are not what you feel. You are not what you feel, you know? And so I think that that is the radicalness in regards to that. Those 7 months being away from my son gave birth to rebellious person. And so when I sit with a patient or I go, because I do in-home therapy too, when I go into a home, I go in with a sense of this is more than just your parent or you just calling. This is where I get to have the opportunity to help you experience what I experienced. And which is healing, Jessica, in essence. And that's what everyone wants. You know, when you look at everything that is happening, that's what everyone wants, freedom and peace. And I always say freedom ain't free and peace is expensive. There are a lot of things that you have to just be able to do to get to that level of peace. And I'm not there yet, but I am on my way. I'm finding I'm finding my way. And so that's what I hope to do with others is to help them find their way. There's a show that I absolutely love, and it is called Where They Find Their Families. I think it's Long Lost Family or whatever. And it says you have to find all of your pieces. And I just believe that in some ways that a part of this work is being able to find your pieces along the way, that somewhere along the line as I'm meeting with a patient, I'm not going to, as a therapist, my job is not to give them the pieces, it's for them to just be able to look in their own spaces and find their piece. And they may go to somewhere else and find the other piece, but the goal is to find all pieces of themselves.
Suzette, what was your brother's name?
Colin Johnson. He is still the most amazing person.
He's still
Um,
with us.
he is still with us. He had a traumatic brain injury, but he is only by the grace of God, he is still here with us.
Well, I was going to ask if you wanted to dedicate our episode to Normal and Rose or your brother, and I think we've got to go for both.
Yes, my mom, she always say to me, Suzette, why can't you be normal? And she always say to me, all I want for you to be is happy. I remember the day that, Xavion was taken. And I said to myself, I need to see her first before I checked out because I'm checking out of here. And she took me in her arms and I think that that's where she gave me she literally birthed me all over again because I could not imagine going through that time and she would just pray with me and she would just pray for me. And sometimes I look at her, I cannot believe that this woman, 5'4", on her tallest day, and she have the strength of Gibraltar. Like, this is a woman who did not have a lot of education, came into this country with nothing, and with 5 kids, 5 of us, and was like, y'all are going to succeed. I don't care. You're going to make, and she made the sacrifices for us to be here. I am absolutely here because of my mom. I am so grateful. I am so grateful that God gave me her. She is my gift. She is my number one supporter. She poured into me, and I always say that she has 5 kids and I'm her 10th child because I gave her such a run for her money. Oh my God, Jessica. If I could go back, I would beat my own ass. I would just be like, girl, what was going on with your ass? It was, yes, it was, but she is incredible. She is an incredible, incredible, incredible person. And I just pray that God just continue to just allow me to show her. I said to someone, I know mountains can move because of Normal Rose, because I have literally seen her move mountains.
Well, I'm going to write that down right now because I need to start saying it too. And we all need to know more about Normal and Rose. She's going to have to join us sometime.
Yes, yeah, she's awesome. And she will love on you, cook for you, but she will beat you. Don't get it wrong. She I am here because of some good old Jamaican discipline. As a mother, don't you touch her grandson. She did not, but she became a gentle parent when she became a grandparent. But I'm so grateful to her.
They do
Grateful.
say that. They do say that, huh? I feel like I hear
Yes.
that all the time. We are so sorry to cut this episode short. We encountered some tech issues. How about that in 2026? We'd like to thank Suzette Fagan for joining us. She's with Door to Door Therapy. Her 2 books titled Raising Davids, as well as When Death Do Us Part Ends, are both available on Amazon. Another to come soon. Please reach out to either us or Suzette if you'd like to get in touch, and we'll see you next time.